Good afternoon, everyone. It's an honor to be here to talk about another big step forward in our province's response to COVID-19. The pandemic continues to throw new challenges at us, and we're responding with due caution. At the same time, we're working to prepare the health system for the future. I continue to work with my department and AHS to plan for possible future scenarios and ways to build capacity to help minimize disruption of care if we see future waves of COVID-19. Vaccinations remain the best tool we have to reduce the impact of COVID, and that's still true today as we react to the first reports of the Omicron variant. While we're still learning about Omicron, vaccines continue to be our most effective tool against COVID in general. This is especially important as we head into cold and flu season and start to look towards the holidays. Nearly 89% of Albertans 12 and over have now had a first dose. That's 3.4 million Albertans, and more than 84%, or 3.2 million people, are fully vaccinated. If you are one of them, thank you. Thanks as well to more than 33,000 children aged 5 to 11 who've now had their first dose, and thanks as well to their parents and guardians. There are another 52,000 appointments booked, and that's more than 21% of all kids in this age range vaccinated or scheduled to be vaccinated. That's another success for Albertans and for the dedicated nurses and other healthcare professionals who are doing the vaccinations. It's also a step forward in reducing the risk for our kids, their families, and our communities as a whole. Now it's time to take the next step and expand access to third doses. Current evidence suggests that vaccines give long-lasting protection against severe disease and hospitalization, but their effectiveness against infection can decrease over time. We consider the emerging evidence and recommendations from the Alberta Advisory Committee on Immunization, and along with Omicron's variant's arrival. And I'm pleased to announce that we're expanding access to booster shots to all Albertans aged 18 and older. People will be eligible when 6 months have passed from their second dose, and the rollout will move forward in stages. The next stage will be Albertans aged 60 and older who will be eligible for third doses beginning next Monday, December the 6th. We're offering third doses to older people first, as we did with first and second doses, because older people are at an increased risk of severe outcomes from COVID-19. Appointments will open tomorrow for anyone in this age range who received their second dose at least 6 months ago, and they can receive their third dose as early as Monday next week. As a reminder, eligibility for boosters is based on birth date, so we ask you to please wait until you turn 60 to book an appointment. Going forward, we will open up bookings to additional age groups as long as we have supply. We anticipate that bookings for all adults age 18 and over will be open by early next year, but the exact timing will depend on the volume of appointments booked and the availability of vaccine supply. Booster doses will be administered by appointment and walk-ins at some sites. Appointments will be available at more than 1,400 pharmacies across the province, as well as AHS sites and participating physician clinics and clinics on reserve. I want to remind you that booster doses continue to be available for all groups we've previously announced, and these include Albertans 70 and older, those in continuing care and other congregate living settings, First Nation, Métis, and Inuit people who are age 18 and older, healthcare workers who received their second dose less than 8 weeks after their first, individuals who received 1 dose of Janssen or 2 doses of AstraZeneca, and individuals with eligible immunocompromising conditions. To date, over 373,000 people in these groups have received their boosters, and that number will keep growing as more Albertans reach their 6-month mark. All the information announced today is available at alberta.ca/vaccine. I encourage you to review the information there and check back to see if any timelines have shifted. If they do, we will, of course, keep Albertans updated in the coming days and weeks. We are also committed to keeping the public updated on the spread of the Omicron variant and any new information we have on its severity, transmissibility, or how it responds to vaccines. Dr. Hinshaw will have more to say on this in a moment. The Omicron variant's arrival in Alberta is another reason we encourage all Albertans to get fully vaccinated if you haven't done so already. Vaccines, combined with current public health measures, remain the most effective way to protect yourself, your loved ones, and your community from COVID-19 and its variants. If you're already fully vaccinated, I urge you to book your booster dose as soon as you are eligible. Thank you, and now I invite Dr. Hinshaw to come to the podium.
Thank you, Minister, and good afternoon, everyone. I want to begin today by thanking everyone who participated in last night's telephone town hall on pediatric COVID-19 vaccines. There was a great turnout and strong engagement from participants, and I am grateful to my colleagues Dr. Jim Kellner, Dr. Cora Constantinescu, and Dr. Cherie Nyson-Jordan, who shared their expertise and insights. A recording of last night's town hall is now available at alberta.ca/townhall. Turning to today's update. Over the last 24 hours, we identified 430 new cases of COVID-19 and completed about 10,800 tests. Our positivity rate is 4.1%. There are currently active alerts or outbreaks in 147 schools. 8 of these schools have had 10 or more cases infectious in the school in the last 14 days. Our hospitalizations are slowly declining over time. There are currently 424 people being treated for COVID-19 in hospital, including 79 in the ICU. Having said that, it is important to note that these numbers are still very high, and current ICU COVID numbers are double the peak of ICU impact from an average influenza season. Sadly, 7 new deaths have been reported to Alberta Health in the past 24 hours. I send my condolences to the people grieving the loss of these Albertans and anyone else who has died. I know that their passing leaves a hole in their communities and their families. As part of my update today, I have additional information to share about Omicron cases in Alberta. We have identified an additional 2 cases in a recently returned traveller from South Africa and the Netherlands, and a household contact. As with the case I spoke about yesterday, these individuals have done nothing wrong and should not be stigmatized. They are isolating, and all appropriate public health follow-up is underway. To date, only mild symptoms have been reported, and these individuals are recovering at home. As with the case we identified yesterday, this is not unexpected, and it is a testament to the excellent work of our public health lab and frontline public health teams. We will identify travel-related cases going forward, and this is the purpose of our measures, to prevent transmission risk from importations and slow any spread. It is also a reminder of the importance of following all current public health measures, including border restrictions, to minimize the risk of COVID-19 importations and transmission. Today's announcement on the expansion of our vaccination program is another important milestone in the pandemic response. My team and I, along with the Alberta Advisory Committee on Immunization and our national counterparts, continue to monitor the latest evidence on vaccine effectiveness, viral spread, and emerging variants of concern, including Omicron. A month ago, when we announced booster doses for those with an increased risk of waning vaccine protection and an increased risk of severe outcomes from COVID-19, there wasn't evidence that conclusively supported the need for boosters in the general population. Since then, more evidence has become available, and we will soon be approaching the 6-month milestone from when the vast majority of adult Albertans received their second dose. For more than a year now, researchers and public health officials worldwide have been gathering and assessing data to learn more about vaccine effectiveness over time and how that might be different for people of different ages and with different risk factors. We've been collecting and analyzing our own data in Alberta as well. Fortunately, the protection against severe disease and hospitalization remains high, even after 2 doses for most individuals. But those who are older and those with chronic conditions have a greater risk of severe outcomes if they have breakthrough infection. Because of this, and given the fact that increased transmission risk in the winter months is lining up with some waning vaccine effectiveness against infection over time, the current evidence supports expanding booster doses to add an additional layer of protection. We still have many people in our communities who have no protection, so offering third doses to more people will be one additional measure to help boost population protection and minimize the spread of COVID-19 going forward. As the Health Minister said, the timing of this expansion should line up well with the 6-month markers for the vast majority of fully vaccinated adult Albertans. Most individuals outside the high-risk groups prioritized for earlier third doses received their second doses in June and July, which means they will be eligible for third doses in December and January. This expansion is also in line with the Alberta Advisory Committee on Immunization's discretionary recommendation that all Albertans 18 years of age and older be offered a booster dose at 6 months after their completion of their series. Whether you are eligible for a first, second, or third dose, I urge you to get vaccinated as soon as you can to improve your protection against COVID-19, both for yourself and those around you. If you're still deciding about the COVID-19 vaccine for your young child, age 5 to 11, I encourage you to listen to last night's town hall recording or speak with a medical professional who can answer your questions and provide you with accurate information as you consider your options. On the topic of pediatric vaccines, I also want to address a very concerning trend. We're hearing reports that some parents are withdrawing their consent for all vaccines at schools because they're worried that their child may receive a COVID-19 vaccine without their knowledge. I want to be crystal clear that no child will receive any vaccine in school without their parent or guardian's consent and knowledge. Parents can be confident that if they have consented to their child receiving routine immunizations, this is the only vaccine their child will receive at school. Parents have the final say on all types of vaccine for their children. It is critical that children continue to receive their standard immunizations to help protect them from diseases like measles, hepatitis B, human papillomavirus, diphtheria, tetanus, and pertussis. Even in the middle of the pandemic, these diseases and other viruses like seasonal influenza continue to pose a potential risk, and we must do everything we can to minimize them. This includes getting the flu vaccine that is widely available for all Albertans 6 months of age and older. For anyone 5 and older, influenza vaccine is readily available at a pharmacy near you. For those under 5 and their families, influenza vaccine can be accessed through Alberta Health Services. I encourage all of us to take advantage of the protection this vaccine offers. Thank you, and we're happy to take questions.
Thanks, Dr. Hinshaw. We have just one reporter, it looks like, at the mic in the room here and a couple waiting on the line, so I think we'll start in the room. Go ahead, first question, please.
Hi, Anna Juncker from the Edmonton Journal and Sun. This is a question for the Minister. I'm wondering what you imagine the uptake on booster vaccines will be, and how will you encourage people to take this third shot?
Thanks so much for the question. In terms of what the uptake is going to be, we'll have to wait and see. But I'm very pleased that we're heading almost to 90% on first doses, and so people who have already made the choice to get the first dose and the second doses are coming up. So hopefully we'll maybe in that range for the third dose. We are going to continue to provide information to individuals about the effectiveness of vaccines and urge them to do so, and continue to answer their questions. We're also working on a strategy to provide more information to deal with those who are vaccine hesitant at this point in time, because we still have roughly 10% of the population, and we're going to continue to work on that 10% to get it as widespread as possible.
Thanks. Follow-up?
Yeah, you mentioned that we're starting with the 60-plus age group, and subsequent age groups will depend on the number of vaccines supply. Is there a baseline number of vaccines that we need to continue with the other age groups?
Yeah, the answer is yes. We have roughly 400,000 vaccines at this, or sorry, 40,000 vaccines present right now in the province. So it'd be able to roll out over December. We have requested additional vaccines from the federal government and working on them in terms of the timing. And we'll have a better sense of what that looks like when we see the number of bookings come in for the age group and the size of that age group. So we are making the request so that we can actually roll it out, in tandem with as we have the 6 months. So for the vast majority would be in January, and making that request and looking at how long it will take the bookings. Typically, when we did the bookings before, when it opened and wide open, it went over a couple of months. So are you going to use that history looking backward in terms of what's the plan for looking forwards and the request for vaccines from the federal government?
Thanks, Anna. We'll go to the phone and take the first caller, please.
Thank you. Camilla DiGiuseppe, CTV.
Hi, good afternoon. This question is for Minister Copping and or Dr. Hinshaw. How does the booster expansion consider those Albertans who have underlying health conditions, in particular those that were part of the Phase B of the rollout and would be nearing that 6-month mark after receiving their second dose? Now, many of those Albertans won't be eligible for their booster until next year, it would appear. Why were they not included in the first phase of the rollout announced today?
Yeah, so we already announced for those who are a certain subset of group, for those who are immunocompromised, have already been announced and are already eligible. And then our focus really is on the highest risk, the next highest risk group is for those age 60 and older. But I maybe ask Dr. Hinshaw to comment further.
Thank you, Minister. I think that with those who are younger than 60 and have chronic medical conditions that would have put them into that eligible group in the category that began receiving first doses in early April, those groups will be eligible at the 6-month mark, again, rolling by age. So, of course, if someone is, say, 20 and has a chronic medical condition, of course, they will need to wait a little bit longer. But we will expand booking eligibility as supply allows. So right now the challenge is that we aren't clear how quickly we'll be able to access vaccine, and also what the uptake will be like in the groups who are currently eligible. So I would say that for those who would be approaching their 6-month anniversary in the next month or so, I would say that there's a possibility that they could get it right at that 6-month date. However, it is possible they'll have to wait a few weeks longer, but ultimately what we know is that the vast majority of Albertans who have received 2 doses of vaccine are still very well protected against severe outcomes, and we need to make sure as we roll out the 3rd dose booking that it's done in a way that is easy to understand and clear. And so we're doing it by age as a very clear cutoff, and we will move as quickly as we can through age groups as long as we have sufficient supply.
Thanks, Dr. Hinshaw. Camilla, follow-up?
Sure, just a short one here. I believe on Monday, the province announced that about 156 people who returned from traveling internationally were being observed or tested for Omicron. Do we know how many people are being observed as of today?
The 156 number was the number of people who'd returned from the 7 countries that the federal government had originally imposed travel restrictions for, and those 156 people were the ones who had come in from visiting those countries in the previous 14 days who were already in Alberta. And so those particular individuals have all received follow-up information and the offer of support, including household rapids for their close contacts in their households, as well as the follow-up PCR. I don't have information as of this moment in terms of how many have had that PCR test concluded, as of course that number changes on an ongoing basis. But again, that was just a snapshot of those who were in Alberta who had been in one of those countries of concern in the previous 14 days. And we are following up not just with those individuals, but of course all individuals who have returned from travel from any country which would be much more than that 156. If they should develop COVID-19, we will be doing the same kind of additional follow-up in terms of case notification, case investigation, and contact tracing, again, for that broader group, because that 156 is just one subset, again, of all of the individuals that we would be wanting to focus follow-up on should they become diagnosed with COVID-19.
Thanks, Dr. Hinshaw. We'll go to the next caller. I think we have two left, so we'll try to take them both, and then we'll wrap up.
Brittany Gervais, Calgary Herald.
Hi, thank you so much for taking my question. This is for the health minister. A few weeks ago, the government had reported that Alberta had canceled about 15,000 surgeries since August, and the number would grow while the healthcare system operates below full capacity. So I believe this was asked a few times in the legislature today for an updated number. So I'm wondering how many surgeries have been canceled or postponed since August to date.
Yeah, so as I indicated a number of weeks ago, it was 15,000. The number would continue to grow. It has grown, but our focus has been on ensuring that we can move resources as the numbers of COVID-19 come down, which thankfully they are. Move those resources into performing more surgeries. The number we're actually quite focused on is what percentage of surgery up to a total of 100% normal capacity are we at? We're at 82% as of last week, and that number is continuing to grow. And then we'll come forward to Albertans in terms of what our plan is not only once we hit the 100%, which we hopefully will be in the near future, but it still is contingent upon the ICU COVID cases coming down. But then how to catch up on the cases that are outstanding, and then what our timeline and plan is to do that.
Thanks. A follow-up, Brittany?
Yeah, so I'm just wondering if we have an idea of how long it could take for the healthcare system to work through this backlog.
Yeah, we're still working on that. When we take a look historically, waves 1 through 3, there was a backlog of roughly 30,000 postponements of surgeries, and we were able to catch up on all those by about August of this year, and then we went into wave 4. So a lot of it is going to depend on what else COVID has to throw at us and what the impact is on our hospital system. But we're also working very hard right now and doing internal work in terms of how do we build more permanent capacity, number one, and then flexible capacity so we can actually flip from performing surgeries into ICUs, but mitigating the impact on surgeries, because we recognize quite frankly that COVID is a reality. We need to plan for that. One can hope that we won't have another wave and be able to move into the endemic phase, but that's we can't plan on that. We need to plan on there's going to be another wave coming that will impact us, and we have the capacity to be able to adjust so we minimize the impact it has on surgeries, and we can provide the best health care for Albertans.
Thanks for that. I think we have time for two more, so we'll do our second last call right now, please.
James Keller, Globe and Mail.
Hi there. I'm just wondering, I know NACI is expected to make a recommendation for third doses for anyone over 50. I'm just wondering why Alberta is going, I guess maybe we see the writing on the wall, but why are we going straight to announcing, 18 and over, just given that, again, that's not quite what NACI's recommended to date?
Yeah, so this was a recommendation from the Alberta Advisory Committee on immunization to potentially move forward to 18 plus. But I'll ask Dr. Hinshaw to talk more about what she's seeing coming from NACI and when that might come.
I have not yet seen the updated NACI recommendations for booster doses beyond what's been published. So I understand that they've been working on that. We know that aligning nationally is always a really important thing to look for lining up across the country. We also know that each individual province and territory has unique circumstances and situations in terms of epidemiology, context, and where we're at in the course of the pandemic. So there's always that balance between wanting to align nationally while making the choices within each province and territory that are matched to, again, the context and epidemiology of each particular individual location. So we had a lot of discussion at the Alberta Advisory Committee on Immunization about what the right path is for Alberta at this time. There is benefit in terms of population benefit moving into the winter months of being able to provide some certainty for people about when they might be eligible for vaccine. And we also know that although the younger someone is, the less likely they are to have severe outcomes from breakthrough. We know that as a population, we currently have a significant impact on our healthcare system still from the fourth wave. And we know that we have a lot of people who have no protection. And so the combined benefit of all of those factors led to, again, that discretionary recommendation from NACI, from the Alberta Advisory Committee on Immunization, to expand ultimately to age 18. And again, what we're doing is that pragmatic approach, beginning with the group that's at the highest risk of severe outcomes should they have a breakthrough infection, and then expanding based on vaccine supply, which again, it really depends on multiple factors. So it's difficult to give a specific timeline on exactly when additional people would be eligible.
Follow-up, James?
Yeah, and this one, for whoever knows the answer, I think in terms of the supply we've got, I thought I heard the minister say something like 400,000 doses. I'm just looking on the government statistics website, and it looks like there's like over 1 million doses, or like that gap between doses received and doses administered, if you don't even take into account the childhood vaccine. So like, where are we at in terms of the number of adult doses that are sitting in storage right now?
It's important to remember when you look at the data on doses received, doses administered, that doesn't take into account appointments that are already booked or people who are going in for walk-ins. So it is a snapshot that's actually missing a component of that. So in terms of uncommitted doses, as in doses that don't already have someone who's booked to receive that particular dose, I would have to get back to you on the specific number. Unfortunately, I don't have that, but it is certainly not 1 million doses. And it's also important to remember that the number one priority, the most impact we will have in terms of offering vaccine is for those who haven't yet received their first or second doses. So it would not be prudent to expand a third dose program in such a way that it would limit availability of doses for first and second doses for those who are still coming forward to receive the protection that initial series offers them and those around them. So all of those factors are components of the planning to make sure that we have that supply available for all of those different groups as we look forward.
Okay. Thanks for that, Dr. Hinshaw. We'll take our last caller, please.
Thank you. Catherine Grigowski, Alberta's Today.
Hi, thanks for taking my question. So up until this point, 2 doses has been considered fully immunized, and I'm wondering, with these boosters coming on board, does that change the definition or the way fully immunized is defined? What does it change?
Well, thanks for the question. It does. We are not changing our definition of fully immunization for the purpose of the REP at this time. We are still considering 2 doses, and the Janssen shot is 1 dose as eligible for that type of program, and then we'll take a look at this as we go forward.
Thanks. Follow-up, Catherine?
Yeah, and speaking of the REP, have the QR codes been tested for 3 doses? Like, I know some people have got that third dose who are in the eligible group. Has it been tested?
I'm going to have to double check on that in terms of whether or not it's been tested associated with that. In terms of, I know that you can actually print it out, and I know that given that the current REP it just looks at 2 doses. You're still going to show up a green light with third doses. My sense is that all doses will actually get printed out on the paper copy associated with that, but I can double check and get that back to you.
Okay, thanks, Catherine. We'll follow up with you after, and we'll wrap it up there. Thanks, Dr. Hinshaw and Minister, and that's all for today. Thanks.
Thank you.